I would like to introduce Özgün Ünver. Dr. Özgün Ünver is a certified life stress and burnout coach working with academics around well-being, mindset, and burnout prevention and recovery. She has a PhD in social policy, a strong interest in psychosocial well-being in the workplace, and a passion for normalizing mental health-related conversations in every aspect of our lives. Her mission is to help academics prioritize self-care, life-work balance, and mental health in order to prevent or overcome burnout. She runs a successful podcast called Mind Your Own Revisions, driven with the motto, feel your feelings, manage your mind, increase your capacity. And what I really enjoy is that she suggests wearing our vulnerability as a badge of honor so that we can all be our authentic selves. Thank you very much, Özgün, and the stage is yours.
Thank you. Thank you for the introduction, Simone. So I will present the more practice side of this whole webinar in terms of so-called preventing occupational burnout. And I am going to do this from my position as a burnout coach for academics, mostly working with academics. My name is Özgün Ünver, and I'm based in Belgium, but originally from Turkey. So I wanted to also give that background information for you. A bit about myself so that you can understand where I'm coming from. So a few years back, I was a social scientist. Well, I still am. I guess once you are, you're always one. And I experienced my burnout towards the end of my PhD and also continuing into my postdoc. And eventually, after some years of recovery and getting lots of different help from coaches, therapists, and medical doctors, I decided to leave my academic career. And what am I doing now? Well, I've trained as a mindset, well-being, and burnout coach, and I'm especially working with academics from all around the world, from different seniorities as well. I'm a member of the Association of Certified Stress and Burnout Coaches that is active in Belgium and the Netherlands. And I'm still working in academia, but not as an academic anymore. And I'm a data steward. I'm a research data management advisor for academics as well. So Irina, in her wonderful presentation, talks a lot about, the definitions and all the challenges around that. Well, as a coach in the practice side of things, I need a working definition of burnout, because we need some kind of assessment to first of all get an overview of the whole situation and monitor progress as the coaching continues. And for that, one of the tools I used the most is called the Burnout Assessment Tool, in short, BAT, which was developed by academics in the University of Leuven here in Belgium. And according to the Burnout Assessment Tool, we look into 4 primary aspects, let's say, categories of symptoms of burnout, and 2 secondary ones. The first one is exhaustion. And you get several questions around exhaustion. And then we have the mental distance part, which used to be called cynicism also, but that doesn't cover the whole thing. So that's an important primary symptom of it as well. Then we have cognitive impairment, which basically refers to all of the things that your brain cannot do anymore. Remembering things, being able to concentrate, focus for a certain amount of time. In later stages of burnout, it is normal for people not being able to read even half a page of a novel because they cannot take the information in. And we have the emotional impairment, where you lose control of your emotions. And the Secondary symptoms are psychological and psychosomatic as defined in BAT. Well, you can always go check out their website. And as I said, this is only one of the tools I use to get an overview of what my clients are going through. An important thing to point out, Irina also mentioned this briefly, burnout versus depression. There seems to be a lot of confusion around this, even if it's not in these terms. Depression, clinical depression, is a mood disorder. It's a mental health condition. Burnout, as we call it in the coaching environment, at least here in Belgium and the Netherlands, it's an energy disorder. And burnout has effects on your mental health, of course, psychological state, of course, but it should not be confused with clinical depression. The diagnosis is different, the so-called treatment is different. So it is, needless to say, very dangerous to just go out and diagnose yourself with all kinds of things. When in doubt, always reach out a medical professional. And let's now look at how burnout happens. Well, the simplest way I can explain to you is that you step on gas and brake at the same time when driving. If you have a driver's license, you probably know this. It is a very bad thing to do because it damages the car. And what steps on the gas is your mind, with the idea of not enough, like I should do more, go for it. And your body steps on the brake because it says, okay, too much, this is too much, like I can't go with it anymore. So you are stepping on both pedals at the same time. And the result is the damage or the loss of control of the vehicle. And well, just like this meme says, some people may think that it's a good idea to press these pedals at the same time, but unfortunately, your car doesn't take a screenshot when you pedal, when you press on both pedals at the same time. And hence, burnout is a built-in biological break to our go, 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 go attitude. So this, in this slide, you see a stress pyramid. It is written in Dutch, but I will translate it to you shortly. Well, basically, we all start in our baseline from this joy of life state, right? And the more you have that, the more you are protected against stress. But stress is not a bad thing on its own. It is very normal to have stress in certain situations and then manage them, and you come back to the baseline, and then you go up to that stress ladder, let's say, and come back. But then once that stress becomes chronic, when it starts going in vicious circle and you cannot get out of it anymore, then you start getting more anxious, more tired. You start experiencing depressive feelings. So I want to nuance that word depressed there. And if you're still going, you end up in burnout. And according to this pyramid, and indeed that is the case, burnout basically puts in the brake, makes you stop from working, from functioning in your daily life because it's detrimental to your health, so that you don't get sick in a worse way. And worst case scenario, death by overwork in terms of occupational burnout, which is our topic today. So some examples of burnout symptoms, these were also discussed before. Well, you have several physical aspects of it that ranges from exhaustion to sleep problems, also pain, digestive issues, skin conditions, all kinds of things might be happening. And for some people, behavioral changes may be more prevalent, like lower performance at work, you make more mistakes, you start avoiding social contacts, you start isolating yourself, absenteeism, or increased use of cigarettes or drugs or other over-the-counter medications. And psychological symptoms are, of course, there that range from mental exhaustion to feelings of more insecurity, lower self-confidence, more rumination, lots of worrying, indecisiveness, which comes from this cognitive impairment I was talking about. Some people may experience crying spells. Some people may experience more irritability. So you don't have one size fits all burnout symptoms. And the most important thing, of course, with every diagnosis is to keep an eye on the changes. If you're, as a person, a very worrying kind of person, and you're worried if you have burnout, well, that may not be an interesting indicator to look at. And we have triggers, of course. Irina also went into this. I will shortly present it in two categories. One is work-related circumstances, and the other one is dysfunctional work habits. So one of it, the first one is more related to your the environment that you are in, and the other one is what you are bringing with yourself to that environment. And coming to diagnosis, that's a bit of a tricky subject because of all of the confusion we have around definitions and ways to diagnose. But as a coach, what I always say to my clients, you have to get your diagnosis, if you need one, by a medical professional. And mostly these are physicians and sometimes clinical psychologists as well. This is, by the way, based on my training and experience in Belgium. In some other countries, unfortunately, I know some people whose physicians are completely ignorant around what burnout is and might look like. So it is, it's an ongoing process of training also physicians around what burnout is and how it might look like. And as I said, we coaches, we do not diagnose or treat burnout either as a condition, but we guide individuals through overcoming burnout symptoms simply. So, and at that moment, once you put it that way, it becomes something that we do irrespective of diagnosis, because what we try to do is address the stressors that are underlying this tendency towards this gas and brake pedaling at the same time. Irina also mentioned this. It was in a corner of one of the slides towards the end. I want to come back to that. We can think of burnout once you get into it, like clinically in a burnout situation. It might be either uncomplicated or complex burnout. The uncomplicated burnout basically means that burnout on its own because of traceable stress-related issues over a long period of time. We're talking about more than 6 months, at least like a year or several years that are building up to that state. But with complex burnout, you have that and an accompanying, usually mental health problem. Mostly I see it with depression or some anxiety disorder. So that is something that needs to be diagnosed by a mental health professional. And in the case of complex burnout, the coach can only be there as a support to any other clinical interventions that might be happening. But in the case of uncomplicated burnout, usually a coach is sufficient. This is also from the point of view of the shortage we have in mental health professionals in Belgium. Sometimes if you're in a state of burnout and you need urgent help, you get in a waiting list of a clinical psychologist, and you may need to wait for months and months before you get there. So a coach is more of an easier person to reach out to, as long as you contact someone who is properly trained in this and who is recognized as a certified coach. And needless to say, best outcomes in both preventing and treating burnout come from getting the support of a team of professionals, so not one person. So this includes a GP or specialists if you need that for the medical aspects, the psychologist for the complex aspects of it, anything that's related to your past or possibly trauma in the past, and a coach tackling more the lifestyle aspects of where are we today, where do we want to go, the behavioral changes that you want to make, and the mindset changes that you want to make. So coaching for burnout recovery has a lot of aspects to go through. I will list some of them here for example, and think of them as going from the outer to the inner, or from more simple to more complex. So starting from simply taking care of your body better. Resting, sleeping, diet, exercise, what is working, what is not working. It sounds very simple, but once you get to that stage, you need to relearn what your body needs, what is communicating to you, and give it what it needs. And then you can start taking care of your mind as well. Mindfulness is a very important tool that we use. I call this mental diet. Basically, you decide which situations you want to go in that are giving you energy versus the situations that are sucking the energy out of you. So you design a mental diet for yourself as well. You start investing in your relationships again, because burnout usually comes with a lot of social isolation as well. Then you can start learning the self-advocacy again, setting boundaries, being assertive, finding out what your needs are and being able to communicate these needs. Self-respect, basically being able to stand up for yourself and say, look, that is not something I'm happy with, I need that change, and so forth. Next, you can start revising your beliefs about yourself, your work, your position in the society. We look at things like fixed versus growth mindset, thinking of intentional thoughts instead of the automatic, unintentional picked up beliefs that come from wherever. So starting to question automatic beliefs, but really thinking, okay, is this really the case? Next, of course, a career audit. That's that we have to do, because unfortunately many people say, oh yeah, I have burnout now, so I have to quit my job, I can't be in this career anymore. No, this is not the case. You can, of course, your burnout might be a consequence of your work not matching with you personally, but that doesn't have to be the case. There are a lot of people after a burnout sick leave who return to the same career and thrive in that career. And Finally, getting on the same page with your supervisor or manager is an important one. Considering how many people end up in a difficult position because of the mismatch or miscommunication with their managers, that is definitely somewhere we need to look at. And finally, yes, it came out too, the time and energy management. That is something that you need to invest in, let's say, making it better for yourself, better time management, better energy management, and that is usually a lifelong task. But of course, not at the same time. So we start tackling these one by one by one. And this is this McClelland iceberg model. That's another way of showing you how we go from the both in the coaching and I guess in other types of burnout so-called treatment modalities. You go from the visible, you know, what is out there. Oh yeah, I'm exhausted and all, okay, and then going deeper into the invisible aspects, from what you do to what you think, to what you want and who you are inside. In terms of recovery versus prevention of burnout, some people are worried whether they're like completely two different things. No, they are not so different. But what is different is usually the duration of the guidance, of the support, and the order of the steps. So if you're already burnt out, of course, we have to start from building your energy back up, and then later on start getting to those building of positive habits, because the so-called car is damaged because of that gas and brake stepping at the same time. But if you're not burnt out yet, or in an earlier stage of a possible burnout, okay, then we don't have to start from scratch, and all effort can be focused on building positive habits and learning better energy management. But of course, the mindset work is never finished. The sky is the limit to becoming more self-aware and more self-compassionate, so that you don't end up in a stage of burnout. This also answers to the question of the linear versus non-linear way to burnout. Of course, it can be non-linear. You can get close to it and then get away from it, and then get close to it again if you stop being aware of what your body and mind need, and if you stop being compassionate with yourself about around those needs. So coming to the preventing of burnout question, of course, we all know that prevention is better than the cure or treatment, right? And I'm guessing that several of you are here to learn about prevention. And I'm guessing that you also Googled how to prevent burnout, right? This is what you find out when you Google how to prevent burnout in 11 tips, 7 ways to feel better at work, 4 tips, 20 strategies, 5 strategies, 7 ways, work from home burnout, burnout in the workplace, 7 ways to prevent burnout. There's this thing with 7, obviously. So if it was so easy with just 5 or 7 tips to prevent burnout, there wouldn't be so many people in burnout. So obviously, I am not going to do that. You won't get a list from me, but the 5 things you need to do, and then it's over. Instead, what you need to remember is to just be human, going back to your human nature. And how does that look like? It might look like learning how to rest and actually resting, engaging in meaningful work that feeds you, relationships, self-compassion, self-advocacy, self-care, play, joy, purpose, giving back to society, mindfulness, knowing yourself, being aware of what you want, really want in life, heartfulness, as opposed to mindfulness, like really being there with your human nature instead of just a mind on a stick. What else do we get here? Movement, of course, exercise, being in nature. Those are all very important things to do. And going back to that slide, I also need to say that for many people, for many of us, this requires a change of our paradigm, the paradigm from which we live our lives. So sorry, not sorry, I won't be able to give you those 7 or 5 tips to prevent burnout. But something I want to come to towards the end of my presentation is preventing burnout in academia. Many of us, many academics, and also non-academics, we think that once we get into this situation of burnout, that it's our fault, that we worked too hard, that we ignored the warning signs a lot. We couldn't take the pressure. So yeah, if you can't take the pressure, academia is not the right job for you, right? There are all kinds of sometimes said out loud, but many times unsaid beliefs lurking around that puts the blame of burnout on the individual. Yes, there are individual aspects of it, but burnout is never your fault as an individual. So there's no need to feel guilt and shame. Of course, it's easier said than done, but please remember that, because burnout starts in the family, in the school, in society, in the workplace. All of these things, the dysfunctional work habits also that you bring to your work and driving yourself to exhaustion, that comes from all of the beliefs that you picked up from your younger years. And as an adult, whether you go through burnout or not, you can influence the system and break the cycle of trauma that's going on and on still today, in the way you plan and do your work, in the way you, if you're a manager, manage people, supervise people, in the way you set priorities and boundaries openly and sticking with them, and in the way that you advocate for another way of performance evaluation or research assessment also in today's academia. So I want to give that hopeful note as well. As we make these changes in our personal lives, it is indeed affecting the bigger group, the whole culture that we are a part of. Even though I said I wouldn't give you like 5 tips to prevent burnout, I have some golden rules just to finish with. First one is, don't believe in everything that you think. When you have negative thoughts about yourself, the way you work, the way you perform, ask yourself, is this a thought or is this a fact? This I see especially in a lot of junior academics who get great feedback from their supervisors about their performance at work, but they're convinced that they are not good enough. So it's something to think about. Prioritize self-care. Self-care is not only bubble baths. It involves taking care of your mental health, emotional health, physical health. Those are all interconnected. And if in doubt, go back to the basics, the diet, exercise, sleep, and build from that. And don't ever override your discomfort by default. Don't say, I just need to push through a bit more. without knowing where to stop. Just come back to yourself and think, okay, what does my body or mind need right now? And ask for help or support or guidance. Nobody can do this alone. We are social animals as human beings, and you have to acknowledge that and live accordingly. And also, you don't have to know the answer to every question in your field of expertise or anything. Saying, I don't know and I need help with this is something that attitude is something that will save you a lot of headache and heartache. And finally, please remember that nobody is above burnout. For the people who are watching this right now, some of you probably haven't gone through burnout yet, or won't ever, hopefully. But don't think that, oh yeah, burnout, that's not going to happen to me. You'll be surprised to how many people it happens to, and who never imagined that they would end up in a burnout. So thank you very much for your attention. I'm finishing with some links of my website where you can also find my podcast and a blog. And please sign up for the newsletter. And feel free to email me or connect with me on LinkedIn, and let's get into a conversation. If you have any questions, feel free to reach out. Thank you.